that's the thing of, you coming back every month and things like that too. I know you have the transportation kind of situation too.
Okay. So it would be ongoing medications, ongoing coming to Houston and seeing the doctor.
Yeah.
Once a month.
Yeah.
Okay.
After those 8 cycles, if you continue the 8 cycles, then we'll be doing what we're doing now. Okay. Mm-hmm. With the transplant, what do you remember him telling you about transplant?
Dr. Patel?
Yeah.
Is it she?
She.
What she's told me so much, be more specific.
So, like, the schedule. Like, what would you...
She's, the actual collection? Or
the actual transplant. Do you remember?
Process would start, she said that, what am I trying to tell you? The first thing would be to determine the status of the cancer. We may have to do a very strong chemo treatment, which would cause me to be... Am I not up far enough?
Yeah, you might need it. Got it?
Never seen my feet come off of that before.
Okay, so strong chemo.
Strong chemo would be totally nauseous. I can do that inpatient or outpatient. She has seen better outcomes and things of that nature in people doing it in the hospital.
Okay.
Because
interesting.
Because of the
infection and
nausea throwing up and
okay.
Could be severe. Have you not seen that?
Well, we don't do transplant here.
Okay.
So
you're not even involved with it.
No.
That's what you're saying.
No.
Okay.
So okay. So then, if you're in the hospital, how long did she say you would stay in the hospital?
And then after, and that's why I was talking to you about the chemo stuff. And then doing the transplant, I want to say that was that 2 weeks to, it really depends on how each person determines.
Yeah, it's usually 2 to 3 weeks. Okay. So,
okay, so usually 2 to 3 weeks in the hospital.
Mm-hmm.
Okay.
Yeah. And then I think afterwards you stay around here close for a couple weeks or something because you have to come in and get your labs drawn frequently.
Yes.
Yeah.
Yeah, that's required.
Yeah.
And I've applied for different places to stay.
Okay.
Which is really interesting.
Yeah.
You know, I get an email that says, you need to move in tomorrow.
Really?
Yes. I'm like, I don't need this place tomorrow, but okay.
Wow.
Yeah.
Okay. Okay. So you understand the time constraint of that.
Yes.
Because I know
totally.
that, you have a business and you have, things that at home you have to kind of take care of too.
Sure.
And so I just, it's either, and I'm looking as far as your quality of life of coming back and forth to Houston a couple times a week, things like that. If you did the stem cell, you would be down here for a while.
Right.
And then you would, you'd probably come back every couple of months or whatever. And then they also have maintenance trials. I have maintenance trials after you do the stem cell. Depending on what Dr. Amanda Sink would want to do, she'll put you on some kind of maintenance chemotherapy. Either it'd be just Revlimid alone that you can, take. But the good thing about that is if you wouldn't be on a clinical trial, you could get an oncologist in Dallas to help with that, you coming back and forth so many times. So there's, a lot to look at, not only from, your medical standpoint, but your, what's going on in your life as well, and your time and, all those things. So, yeah.
Okay, so she says I'm doing very well, and I understand that. Knowing that this disease is not curable, what exactly does that mean?
Okay.
You're doing very
So
well.
that means, okay. So remember that chart I showed you where you started up here and it went
Yes.
whoop, like
Yes.
that?
Right.
Okay. So that was our goal, is to get it down, right? So, so in that standpoint, right now, that response is great. You did really well, okay?
Okay.
What we want to do and what we hope with is with the transplant or whatever you decide, we keep it at this level where it's at the bottom for a very, very long time.
What's a long time?
Years. That's what we hope. Okay?
Does that mean 2? Or does that mean 10?
It depends. Each
Okay.
person's different.
Okay.
Okay? So what we hope is for it to be that straight line for as long as we can get it. Okay?
Okay.
And then if we start to see it going up, then we give you another treatment to get it back down.
Okay.
Okay? Now, further down the road, there is other options for a second transplant, or just there's multiple lines of therapy that you could, continue to get it back down and then continue at that level. So our main goal is just to keep it at that level forever, if we can. Okay? So what she sometimes does in multiple myeloma we do is we'll get it to this level, we'll do transplant, and then we do a maintenance, as we call, is giving you a small dose of chemotherapy for you to take every day to keep that from being.
Any of the meds I'm already on?
Sometimes we do Revlimid, but it's very small. It's a much smaller dose than your high dose.
Okay.
So it could be 10, 5, just very small.
Right.
One of the trials that I have right now is in a type of infusion, which probably wouldn't be good in your sense because you have to come every week, So there's a lot of options, okay? And those maintenance have a lot less side effects than your first one because we're trying to kill it, right? We're trying to get you down to that point.
Right.
So we're going to give you a little more harsher stuff and where you kind of feel crappy until we can get that, disease response.
Right.
So, does that kind of make sense? Did I answer your question? Okay. Yeah. So that's kind of the explanation of, and some doctors you'll talk to, they rather the upfront stem cell than the delayed stem cell. But right now, we just don't have the data to say one is better than the other.
Right.
Okay, we're working on it,
Okay.
but we don't have it yet.
All right.
Okay,
I appreciate you taking the time to say that.
that's it's 50-50 right now. Okay,
Yeah.
so I mean, down the road it could be different, but with people like you that are so gracious to do a clinical trial, this is what we do to see. You had an awesome response, right? You're 99% reduction, after 3 cycles or 2 cycles, I think, right?
2.
So in the future, this could be the standard of care for people,
Right.
with multiple myeloma. So, that's what is great about doing clinical trials is, and hopefully a person that's doing a clinical trial now, in the future, they'll have a cure for it. That's our goal. So,
Are you working with a lot of people that have the light chains?
yeah, mostly all the multiple myeloma people have high light chains. They might be different types of light chains. Either there's the lambda and there's the
Right.
kappa.
Right.
Some have kappa disease of light chains and some have lambda disease
Right.
of light chain. Yeah, but there's always, usually there's always light chain, high light chains.
Okay. All right. Makes sense.
Okay. So, as far as the schedule, so I'm working hard on, we have your schedule today. We got at least Monday. I actually went ahead and scheduled all of them at the Woodlands, but I can change it. Okay. So Monday,
Sure.
the labs are gonna be at the Woodlands.
Okay.
Okay.
Oh, I forgot that one. No, we gotta change it because I'm gonna actually be down here in Houston. Sorry.
The one time.
So you have to ask
Okay.
me specific questions. I can't.
All right.
I
so
mess
we
up on that kind of stuff.
Okay, so one Monday to be here.
Mm-hmm.
All right.
Sorry, I wasn't even
It's okay.
on board with that one.
labs Here at ND.
Yeah, I'm coming back down on Sunday.
Okay. And I'm working. I tried to pre-schedule I'm trying to do my best to get you a decent time, on Monday. So we'll see what they do, you know, because I can put all I want, you know, please schedule this time, please schedule it this time, but if they don't have the time available, then they can't put it, you know what I mean?
Okay, everything okay?
Yeah, we're good.
Oh, you're just getting the EKG? Okay.
Yeah,
very
we're
good.
just talking.
Okay, okay, bye-bye.
So,
So move my hand. You alright?
You okay?
so I'll try my best. Were you able to talk to the patient advocate?
No, I have not yet.
Okay. Okay.
I was thinking about that, gosh, I guess on Wednesday, like, on my week, my good week, which is, you know, is right now.
Yeah.
When I'm building back up, I have so many things planned.
Yeah, I'm sure. Okay. Let me go run real fast and change this before everybody goes home for the
Okay.
holiday.
Okay, I understand.
Okay?
Yes. Thank you.
You're welcome.
Man. And we thought